Ready for a deep dive? Today we're going deep on something you might not see every day. Paracondylar process fractures in horses.
Definitely not your everyday case, but as we'll see, it can really mimic a whole bunch of other problems, especially in those high-performance horses.
For sure. And to guide us through this, we've got a recent article straight from the Equine Veterinary Journal. 3 cases, all different, all fascinating.
Oh, and you know those EVJ articles? Packed with imaging. We're talking serious CT action in this one.
Music to my ears. But before we get ahead of ourselves, let's do a quick anatomy recap. For those who haven't gotten up close and personal with a horse skull lately, where do we even find this paracondylar process, and why should we care if it's fractured?
Okay, so picture this. You've got your horse skull, right? Big occipital bone at the back of the head. Now, the paracondylar processes, they're like these little bony protrusions coming off the occipital condyles right there flanking the foramen magnum.
Okay, little bony wings, I'm picturing it. But they're not just there for looks, are they?
Not at all. They're actually super important because they're where a bunch of muscles attach muscles for head movement, chewing, swallowing, the works. So when you get a fracture there, depending on where it is, how bad it is, you can get some really varied clinical signs.
A small bone with big responsibilities then. Okay, let's jump into the deep end with our first case. What are we dealing with?
All right, case number 1. We've got a 5-year-old warm blood gelding show jumper. The owner's telling us he's got decreased neck flexibility. It feels heavy in the bridle, mostly on the right.
Heavy. Those subjective terms are always fun, right? But hey, you got to start somewhere. What else were they seeing?
So these signs had actually been gradually getting worse for about 2 months before the horse was even seen by a vet.
Not exactly an acute presentation then. What did the clinical exam show?
Well, when they examined him, he did have a bit of reduced range of motion in his neck, which makes sense, right? But here's the kicker. No obvious swelling, no heat in the area, and get this, no neurological deficits in the head at all.
Interesting. So not as straightforward as you'd think. What was their next move?
They did find lameness in both front legs, though.
The plot thickens. Lameness and a vague neck issue sounds like a recipe for a headache. Where do they even begin?
They actually went after that forelimb lameness pretty aggressively. Nerve blocks, radiographs, ultrasound, you name it. Turned out he had some foot imbalance, signs of proximal suspensory dysmopathy.
Proximal suspensory. Just for our listeners who might not be vets, could you give us a quick refresher on what that means?
Sure. Basically, it means there's damage to the suspensory ligament, which runs down the back of the cannon bone, and it's a really common cause of lameness, especially in performance horses like this warm blood.
Makes sense. So they're thinking, okay, this could explain the lameness, but what about that pesky neck stiffness?
Exactly. They weren't ready to give up just yet.
So how do they investigate further?
They did a bone scan looking for any hot spots, any signs of inflammation in the neck.
The good old bone scan, always hoping for that clear area of uptake, right?
Well, in this case, it showed some minor changes in his caudal cervical articular process joints, which you often see, but nothing screaming out in the cranial cervical region where our paracondylar process is hiding.
So still no closer to figuring out the neck issue. What did they do?
Radiographs of the neck were also pretty much normal. They were starting to run out of options.
I bet. At this point, they must have been tempted to just throw in the towel. What was their saving grace?
They had a hunch, though, and thank goodness they did. They decided to go for the gold computed tomography.
The CT scan. The ultimate peek behind the curtain. Did they do a full head CT or just focus on a specific area?
Well, they actually did 2 CT scans. First, a standing cone beam CT of the caudal cervical region, which was normal. But then they did a standing helical 64-slice CT of the head and cranial cervical region, and bam, there it was.
The elusive paracondylar process fracture reveals itself.
Exactly. And the CT images, they were crystal clear. A complete non-displaced fracture of the left paracondylar process. And get this, the bone was thickened and sclerotic, meaning this fracture, it had been there for a while, silently doing its thing.
A chronic fracture. Sneaky. So even though it wasn't displaced and it was an old injury, they thought it could still be causing that neck stiffness.
That's what they were thinking, for sure.
So what do? Go in for surgery.
Because he had that forelimb lameness too, they decided to play it safe and start with conservative management of the fracture. 6 months of rest, no riding, and no bit.
Sensible approach. Give everything a chance to heal and then reassess. Did it work?
6 months later, they recheck him. Good news. The neck stiffness. Gone. Completely resolved, but...
Oh, there's always a but, isn't there?
The forelimb lameness was still a problem, so they couldn't really see how he moved under saddle. And to make things even more interesting, they repeated the radiographs and did another CT, and guess what? The fracture. Still there.
Hmm.
non-union, just hanging out.
Talk about a frustrating case. So did they ever figure out if that fracture was the real cause of the neck stiffness, or was it just an incidental finding?
That's the million-dollar question, isn't it? Because it was a chronic fracture and there weren't any inflammatory changes on that initial bone scan, they thought it might have just been an incidental finding.
A silent but present fracture. Makes you wonder how many of these were missing out there.
Definitely makes you think twice, especially when you've got these performance horses with multiple things going on. On to case number 2. And this one's interesting. We've got a 2-month-old warm blood colt, and he's showing signs of facial paralysis.
2 months old. Oh, that's rough. Facial paralysis at that age. What were his symptoms? How long had it been going on?
So this little guy, he'd had these classic facial nerve paralysis signs for about 4 weeks, all on the left side. His left ear was drooping, his muzzle was pulled over to the right. He had loss of that lower lip tone, again on the left side.
Ah, poor little guy. Did they say anything about his eye? With facial nerve problems, you always worry about those corneal ulcers.
Good catch. They did mention that he had ptosis of his left eyelid, so it was drooping, and he wasn't blinking properly on that side either. They didn't say specifically if there were any ulcers, but I'm sure they were keeping a close eye on that.
Absolutely. So we've got these really specific deficits all on the left side of his face. Did they have any ideas what could be causing this in such a young foal?
Well, because the signs were so clearly one-sided and they involved those specific nerves, they were already thinking it had to be something directly affecting that left facial nerve.
Okay, so not a central nervous system issue, but something out there impacting the nerve itself. And given where we are in this deep dive, I'm guessing this is where our paracondylar process comes into play.
You know it. Remember how we were talking about how close that facial nerve is to the paracondylar process, right where it exits the skull? They were thinking maybe a fracture in that area could be pressing on the nerve and causing the paralysis.
That makes a lot of sense, but you'd think they would have felt something on the exam, right? Especially in a young foal.
It's not always that simple, unfortunately. That facial nerve, it exits through this tiny little hole in the skull called the stylomastoid foramen, and guess what's right next door? The paracondylar process. So a fracture there, especially in a growing foal, it might not be easy to feel.
Right. Those skulls are still so pliable. So what did they do? Did they go straight to CT or did they try radiographs first?
They did try radiographs, but just like our last case, the images weren't detailed enough to give them a confident diagnosis, just too much bone overlap in that area. So it was CT time. They used a cone beam CT system for this little guy.
Cone beam fancy. What did the CT show?
The CT was really telling. It showed a fracture, right where they suspected, of the dorsal part of the left paracondylar process. And get this, it even extended into the temporal bone.
Wow, so not just the paracondylar process, but involving the bone around the ear structures too. That's a significant finding. Could they tell from the images how long this fracture had been there?
That's the thing. The CT actually showed signs of chronic changes bone remodeling, some thickening at the fracture site. So they figured the fracture probably happened a while back, maybe even around the same time those facial paralysis signs first started.
So he might have been dealing with this from a very young age.
Oh, the poor thing.
So with the diagnosis made, did they try to do surgery?
This is where it got a bit tricky, because the fracture was on that dorsal part of the paracondylar process, and it involved the temporal bone surgery to repair it or take out the fragment, just way too risky. Too many important structures in that area, the facial nerve itself, the guttural pouch, they didn't want to make things worse.
That makes sense. Sometimes the best intervention is no intervention, as they say. So what were their options?
They went with conservative management. For this little guy, that meant strict stall rest for 6 weeks, plus medications to help keep his eye from drying out, and anything to manage pain or inflammation.
6 weeks of stall rest for a foal. I can only imagine how that went. But did it help?
It did. Get this. 12 weeks after the injury, so about 3 months total, he started to show real improvement in his eyelid and ear function.
That's fantastic. That must have been such a relief.
For sure. And it makes sense, too, when you think about how nerves heal. The nerves that control the eyelid and ear, they're shorter and closer to the injury site than the ones controlling the other facial movements. And nerve regeneration, it's a slow and steady process. We're talking 1-2 millimeters a day.
Wow, millimeters a day. So the closer you are to the injury, the faster the recovery. That's fascinating. But what about the rest of his face? Did he get any improvement in that muzzle deviation or his blinking?
You're asking all the right questions. You see, while his eyelid and ear were definitely getting better, at that 3-month checkup, he still had pretty noticeable muzzle deviation, and he still couldn't completely close that left eye.
So those longer nerves controlling the muzzle and eyelids still had a ways to go. Did he eventually make a full recovery?
He did. Not overnight, of course, but by the time he was 10 months old, that facial paralysis had almost completely resolved. All that was left was this super subtle muzzle deviation, and you'd really have to be looking for it to notice.
Now that's a happy ending. It's amazing how resilient these young horses can be.
They really are. It's a good reminder that even with a tricky diagnosis like this, sometimes the best thing we can do is give the body the time and support it needs to heal.
I couldn't agree more. That was quite a case. Ready to tackle case number 3. I hear we have a head shaker on our hands.
That's right. In this case, it really drives home the importance of a thorough workup and considering all the possibilities. Let's dive in. All right, case number 3. This one's a 10-year-old warm blood gelding, show jumper, and he's got a history of, get this, intermittent head shaking.
Intermittent. Okay, that's tricky right off the bat. How long had this been going on?
3 years.
3 years of on, off again head shaking. That's a long time to be chasing a diagnosis.
Yeah.
What finally made them think of the paracondylar process?
Well, the interesting thing is, it all seemed to start after he took a tumble in the field. Rotational fall, actually.
Ah, so trauma-related. You'd think a fracture would be at the top of the list with that history. Did they go looking for a paracondylar process fracture right away?
You'd think, right. But this one's a real head-scratcher. They did a bone scan initially, but just like our first case, it didn't show anything too obvious in the paracondylar process area.
Those sneaky fractures trying to stay hidden.
Right. They did see some mild changes in his right caudal, cervical, articular process joints on the bone scan. And when they examined him, he was really sore in that area, especially over on the left side over the parotid region.
So lots of potential red herrings in this case. What did they do next? Conservative management first or straight to the CT?
They actually started with conservative management, rest, oral, anti-inflammatories, all that good stuff.
The classic first line of defense. How do you respond?
And it worked. For a while, at least. His symptoms resolved, he went back to work, everything was great.
You're giving me that but again, aren't you?
There's always a but. About 18 months later, that head shaking. Back with a vengeance.
Oh no, not again. So frustrating. What did they do then?
So this time they decided to try injecting those articular process joints with corticosteroids, just to see if they could settle down any inflammation that might be hanging around.
Makes sense. Didn't work?
And once again, he improved. And I bet you can guess what's coming next.
Oh, dude, tell me. The head shaking came back.
You got it. This time about 16 months after those injections.
This poor horse. It's like every time they thought they were in the clear, the head shaking would rear its ugly head again. But at that point, they must have been pulling their hair out. Did they finally decide to go for the CT scan?
Third time's the charm, right? So they did a standing helical CT scan. And this time, finally they found it. A chronic, non-displaced, non-union fracture. Mid-ventral portion of the left paracondylar process.
Bingo. After 3 years, the culprit is revealed.
Right. And it just goes to show you, those subtle findings, they can really fly under the radar. They even went back and looked at his original bone scan from 3 years prior, and guess what? There was this super subtle area of increased uptake right where that fracture was.
It was hiding in plain sight all along. Talk about a case for persistence. So they finally had their diagnosis, but the million-dollar question is, what to do about it? Did they go straight to surgery?
So surgery to remove that fragment, it was definitely something they discussed, but of course that's a big decision. It's a delicate surgery, and there's always that risk of complications. So they said, let's try conservative management one more time. 6 weeks of paddock rest.
Back to R&R.
And guess what? He responded well again. Symptoms improved. Back to work he went.
Okay, so far so good. But I have a feeling this isn't the end of the story.
You're catching on. Because about 2 years after that initial CT scan, he had this major flare-up.
Not just a little head shaking this time, I'm guessing?
Oh, this was serious. Severe head shaking. We're talking bolting. Hypersensitivity around his pole, even trying to put a halter on him became a real challenge.
Oh, wow. That's really rough.
It was. And to make matters worse, they couldn't get the pain under control. They tried everything. Phenylbutazone, gabapentin, you name it. Nothing seemed to help for very long.
So at that point, they were really running out of options. Did they finally decide to go ahead with surgery?
They did. It was clear conservative management just wasn't cutting it anymore, so they made the call to go in and surgically remove that fracture fragment. But because his head was so sensitive, they had to wait until that acute inflammation calmed down before they could even think about operating.
Understandably. Safety first, especially with a horse that's head shy.
Exactly. Now, here's the cool part. During the surgery, they actually used ultrasound guidance to help them find that fracture fragment.
Ultrasound guidance for fracture removal. That's incredible. I've never heard of that.
It's not something you see every day, that's for sure. But it worked really well. They were able to use the ultrasound to get this really precise image of the surgical field during the operation. Meant they could be really accurate with their incision, minimize how much they had to move tissues around, all about reducing that trauma.
Wow, talk about high tech. So they were able to get that fragment out.
They did. And the best part is, the horse recovered beautifully. A little bit of swelling for a few days after the surgery. He was a bit picky about eating for a bit there, but that's understandable.
I can imagine. Eating with a sore jaw isn't exactly fun.
Right. But everything resolved quickly, and at his follow-up, he was reported to be back to his old self. No more head shaking, back to jumping, happy athlete.
Now that's a happy ending. This case was quite the journey.
It really was. And, it just goes to show you, these paracondylar process fractures, they can be so subtle, so easy to miss, especially on those initial radiographs.
Absolutely. You really have to be thinking about that, especially in horses with a history of trauma or those that just aren't responding the way you'd expect.
Exactly. And this case, it's a testament to advanced imaging, that CT scan. It was a game changer. Who knows where this horse would be without it?
Couldn't agree more. And, it highlights something really important. Even though conservative management is often the first choice for these fractures, surgery can be a really good option when that conservative approach doesn't give us the long-term results we're looking for.
For sure.
Well, this has been fascinating. 3 very different cases, all highlighting how tricky these paracondylar process fractures can be to diagnose and manage. A huge thank you to you for diving into these cases with us and sharing your expertise.
My pleasure. It's always fun to geek out on a little equine neurology.
And to all our listeners, whether you're a seasoned vet or just starting out, we hope this deep dive has given you some food for thought. From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.